Hey everyone, and welcome back to my channel. This is The Brain Unknown, and I'm here to help shed light on the mysteries of the mind. I first want to say that I am incredibly grateful to each of my recent subscribers for joining me on this journey towards building a compassionate and insightful community. Your support means the world to me, and together we'll continue to cultivate a space where knowledge, understanding, and empathy thrive for the benefit of ourselves and others. So thank you so much for being a part of this amazing adventure. Today, we're going to tackle an important mental health topic, and that is depression. Depression affects millions of people worldwide, yet it is often misunderstood or stigmatized. In this video, we're going to delve into what depression is, how people develop depression, and ways to cope with it. I will also provide resources at the end of this video that can help those struggling with depression or those who know someone who is. Remember to check the description box below for links to these resources. But before we begin, here's a quick disclaimer. The information in this video is for educational purposes only and should not be considered as professional medical advice, diagnosis, or treatment. Now that we've got that out of the way, let's dive into the world of depression. Before we get into what depression is, it's important to recognize its symptoms and how it's diagnosed. Depression can manifest in various ways and may include the following symptoms: persistent sadness or feelings of emptiness, a loss of interest or pleasure in activities you once enjoyed, changes in appetite or weight, sleep disturbances, such as insomnia or excessive sleeping, fatigue or a loss of energy, feelings of worthlessness or excessive guilt, difficulty concentrating, making decisions, or remembering details, irritability or restlessness, thoughts of death or suicide attempts. In order to diagnose depression, mental health professionals typically use the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, better known as the DSM-5. A diagnosis is made based on the presence of symptoms, their duration, and their impact on daily functioning. Depression is a common but serious mental health disorder characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities. It can affect a person's thoughts, feelings, behavior, and overall physical health, making it difficult to function in everyday life. Depression is more than just feeling down or blue. It's a complex condition that can have a significant impact on a person's well-being. There are several types of depression, including major depressive disorder, characterized by severe symptoms that interfere with daily functioning. Major depressive disorder is the most common form of depression. Symptoms must be present for at least 2 weeks for a diagnosis to be made. Persistent depressive disorder, or dysthymia. This is a mild or chronic form of depression lasting for at least 2 years, with symptoms that may be less severe but are still impactful. People with dysthymia may experience periods of major depression as well. Postpartum depression. This is a form of depression that affects some women after childbirth, with symptoms that can range from mild to severe. This is different from the baby blues, which are mild mood changes that typically resolve within 2 weeks of giving birth. Seasonal affective disorder. This is a type of depression that typically occurs during the winter months when daylight is limited. Seasonal affective disorder can effectively be treated with light therapy, which exposes the individual to bright artificial light to help regulate mood. Bipolar disorder. Formerly called manic depression, bipolar disorder involves periods of depression that alternate with periods of mania or hypomania, which are characterized by high energy, impulsivity, and elevated mood. Depression is a complex condition with multiple contributing factors, including biological factors. Genetics may play a role in the development of depression, as the condition tends to run in families. Additionally, imbalances in brain chemicals called neurotransmitters, such as serotonin and dopamine, are thought to contribute also to depression. Hormonal imbalances, like those experienced during menopause or pregnancy, can also trigger depression. Psychological factors. Personality traits such as pessimism or low self-esteem can increase the risk of depression. A history of trauma, abuse, or neglect can also contribute to the development of the disorder. Co-occurring mental health disorders like anxiety or eating disorders may also increase the risk of depression. Environmental factors. Life events such as job loss, relationship problems, or the death of a loved one can trigger depressive episodes. Chronic stress and exposure to negative environments can also contribute to depression. Socioeconomic factors like poverty or lack of access to quality health care can further increase the risk of developing depression. There are several effective treatment options and coping strategies for managing depression. Psychotherapy. Various types of therapy, including cognitive behavioral therapy, interpersonal therapy, and psychodynamic therapy, can help individuals address the underlying thoughts, behaviors, and emotions that contribute to their depression. Therapy can also help develop healthy coping strategies and improve communication skills. Medication. Antidepressant medications such as selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, and tricyclic antidepressants can be effective in treating depression by helping to regulate neurotransmitter levels in the brain. Lifestyle changes. Engaging in regular exercise, maintaining a healthy diet, getting sufficient sleep, and reducing stress can all have a positive impact on mental health and help alleviate depressive symptoms. Social support. Connecting with friends, family, or support groups can provide emotional support and help individuals feel less isolated. Mindfulness and relaxation techniques. Practices like meditation, deep breathing exercises, or progressive muscle relaxation can help manage stress and improve overall well-being. Seeking professional help. It's essential for those struggling with depression to consult a mental health professional, such as a psychiatrist or therapist, for proper diagnosis, support, and treatment. If you or someone you know is struggling with depression, it's crucial to reach out for help. Always remember, you are worth it and have a purpose. There are numerous resources available to provide support and guidance. Some of these resources include the National Suicide Prevention Lifeline and Crisis Text Line, Samaritans in the UK, Befrienders Worldwide, and the National Alliance on Mental Illness. Remember to check the description box below for links to these resources. It's important to educate yourself and others about depression to help reduce stigma and increase understanding and support for those affected. Thank you so much for joining me today in our exploration of depression. It's my hope that this video has shed light on this important mental health issue and provided valuable insights to help those affected. If you'd like to see more content like this, please make sure to like, comment, and subscribe. Thank you so much for watching, and I look forward to seeing you in the next one.